Hi, Dr. Jane Hendricks here with Stem Cell for Life, and I wanted to do a quick video on the different options that are available in the area of regenerative medicine and the vetting that physicians should do when talking to different reps and distributors. I've been doing this since 2017, and there weren't all of these distributors around. They popped up 2019, 2020. So the confusion has definitely increased. And so I had been working with umbilical cord stem cells this whole time, and mainly I just heard about Panama, which wasn't that confusing. They offered high dose stem cell IV, and they did expansion. That's why they're in Panama, not here. The FDA never has allowed expansion. So on the certificate, on my certificates, when I open the product, it's from a couple months ago. But if it's expanding, I don't know when the umbilical cord tissue was harvested. So like one clinic in Mexico I talked to, they've been expanding stem cells from tissue that was harvested 8 years ago. So I think it's better to do non-expanded. I think if I was a patient, I'd prefer the certificate to say like 2 months ago. Also, certificates aren't even required if you're outside the FDA registration codes. So in this country, there's a couple things that happened like starting in 2021. For one thing, the viability needed to be documented. So labs did close down because of that, meaning for 50 million stem cells, how many of them are alive? I'm really surprised that patients still are not asking that question when they call. They ask for price, but they don't ask like number and viability. There's just so many options out there. You could get 10 million stem cells, you could get 30 million. So it's important to know how many stem cells you're getting. And if you're getting quoted in milliliters of fluid, then you know you're not even getting stem cells. You're getting something else, amnioplacenta, Wharton's jelly possibly. It should be quoted as a number. I offer both. I offer the stem cells, the mesenchymal stem cells, the superior kind derived from both cord blood and Wharton's jelly, which is important for circulatory and structural. So you want the both. You want the part of it, especially when I'm treating a lot of autoimmune conditions, IBD, lupus. So I want the vascular endothelial growth factor part of the stem cells that's obtained from cord blood stem cells, very rich. And so that's wonderful for the immune system. For COVID vaccine adverse events, you want the stem cells derived from both. You want that cord blood and the Wharton's jelly. So they both are combined. And then you can just do Wharton's jelly, and that's Wharton's jelly tissue matrix quoted in cc's of fluid or milliliters of fluid. And you can do that for knee or shoulder or hip for the purpose of providing support and cushion and scaffolding. It's best to combine that with stem cells, but can also be used alone. So as far as IV, you can do exosomes, you can do stem cells, and then the part where the doctor should be doing this for you on your behalf is vetting where the distributor is actually getting the biological product. Are they getting it overseas? Is the umbilical cord tissue harvested overseas and they're bringing it in and processing it here? That does drop down the price for you, but it's also illegal. So it's outside the FDA jurisdiction, and it's in essence smuggling. It's happening because there's another distributor. There's a number of people that I've called that I thought were labs like Platinum Biologics and found out that it was just a distributor. They wouldn't tell me the name of the lab, so I had to stop using them. Rubella, again, is not a lab. There's no FDA registration number for them to process blood or tissue. It's just for the distributorship. So that is not a lab. So it's really hard for a doctor to find out the source of these biological products. So I'm just working with the one the one that I've always worked with, which has been around the longest, used to serve the US military, has all the check marks, and I don't have to worry about, first do no harm. Somehow the profit became the number one, and then the first do no harm went to number, 2, 3, or 4. But of course, I want to keep the price low, and I work diligently to do that, but I will not sacrifice safety, nor will I sacrifice efficacy. I want good results. And for autoimmune conditions, I'm standing at 100% success rate. So I'm not going to lower my 100% success rate down for the sake of cost. So you'll find that if you go through the right clinic, the right doctor, that you'll get a pretty good price for what you're getting. You're getting the superior product with my clinic. You won't have to have any safety concerns, and you'll look forward to getting really good results. For more information, take a look at the product guide on my website, stemcellforlife.com, that outlines the different products available to you, the exosomes, the Wharton's jelly, and the mesenchymal stem cells, and how they should be measured in units or quoted to you for price. So that will clear up some confusion. And you can call the office to schedule a complimentary consultation with me, and I'll go over your protocol and pricing, and we can go from there.